The State Medical Board of Ohio presents a brief introduction to Ohio's subacute and chronic pain prescribing rules. As of December 23, 2018, rules are in place that prescribers need to follow when prescribing opioids for the treatment of chronic and subacute pain. In this video, you'll learn more about them, when they apply to your patients, and what steps you need to take at certain dosages and durations of opioid therapies. Over the last several years, Ohio has taken significant steps to address the opioid crisis. And thanks to the efforts of prescribers like you, important progress has been made. The Ohio Automated RX Reporting System, ORS, has been a valuable tool in tracking prescription drugs. By integrating it into electronic health records and pharmacy dispensing systems, direct access has been provided to 20,000 prescribers and pharmacists. As a result, the number of queries for patient information in ORS increased from 1.78 million to over 88 million. And according to the American Medical Association, that makes Ohio #1 in the country in prescriber responsibility. That responsibility has translated into safer use of prescription drugs. The number of individuals engaged in doctor shopping fell by 89%. And between 2012 and 2018, 325 million fewer doses of opioids were dispensed in our state. Those numbers are impressive, but it's critical that Ohio remains vigilant. The dangers of prescription opioid abuse are still very real, and establishing safety checkpoints on their use in long-term pain management will help ensure that treatment improves the lives of your patients without increasing the risks of addiction. As stated earlier, rules that prescribers need to follow when prescribing opioids for the treatment of chronic and subacute pain took place at the end of 2018. Subacute pain is defined by law as pain lasting between 6 and 12 weeks. Chronic pain is pain which lasts 12 weeks or more. The specific requirements for physicians and physician assistants can be found in Ohio Administrative Code 4731-11. It's important to remember that these regulations aren't meant to take medication away from those in need. They're meant to strengthen communications between prescribers and patients. There are two main areas that the regulations cover: increasing patient awareness of risks and establishing checkpoints at specific morphine equivalent doses. So let's start with the first, increasing patient awareness. The prescribing rules require you to engage in open conversations with your patients before starting them on long-term opioid treatment. You'll need to complete and document a full patient history, including an ORS check, prescription history, and their risk of substance use disorder. You'll need to complete and document an appropriate physical exam, imaging studies, or lab tests if needed, including urine drug testing, and you'll need to complete and document a functional pain assessment and treatment plan. Prior to treating, or when you decide to treat subacute or chronic pain with an opioid, you'll first need to evaluate whether a non-opioid or a non-medication treatment would be appropriate and document that evaluation in the patient record. If you determine that opioid medication is appropriate, you should prescribe it for the fewest amount of days and lowest dosage needed to adequately address the pain. Part 2 of the rules establish checkpoints to ensure appropriate prescribing of opioids. Remember, these are checkpoints, not limits. As a prescriber, you should always use your best clinical judgment to ensure that patients are being treated appropriately. If you're prescribing opioids at a morphine equivalent dose, or MED, of 50 or higher, a follow-up assessment and review of the patient's response and adherence to treatment must occur at least every 3 months. At 50 MED, prescribers must obtain written, informed consent from the patient regarding their treatment. You'll be required to review and, if appropriate, update the status of the patient's underlying condition. You'll need to assess functioning and look for signs of prescription misuse, and you should consider consulting with a specialist or obtaining a medication therapy management review. At 80 MED, prescribers are required to obtain a written pain management agreement to ensure that patients have no misunderstandings about the medication they're taking. Sample agreements can be found on takechargeohio.org in the Resources for Health Professionals section. You will also need to look for signs of opioid prescription misuse and either consult with a specialist or obtain a medication therapy management review. The next critical checkpoint at 80 MED, prescribers must offer the patient a prescription for naloxone. This is an opportunity to speak frankly with patients about the risk of overdosing. In order to prescribe a dosage that exceeds 120 MED, there has to be a recommendation from a board-certified pain medicine, hospice, or palliative care physician, and that recommendation has to be based on a face-to-face visit and examination. The recommendation isn't needed if the prescribing physician is board-certified in pain medicine, hospice, or palliative care. And consultation is not required if the patient was already on a dosage of 120 mEd prior to December 23, 2018. As we mentioned earlier, the rules aren't meant to take medication away from patients in need. They take into consideration patients who are already being treated for chronic pain by not establishing a maximum dose or duration of treatment. They don't apply to patients being treated for terminal conditions, patients in hospice care, or those in a hospital or inpatient setting where they can be closely monitored. For patients who are already being treated for chronic pain with opioids, medical standards of care still apply, but the dosage checkpoints won't be needed unless their average daily dose increases. At TakeChargeOhio.org, you will find many resources designed to support prescribers who are integrating the subacute and chronic pain prescribing regulations into their practices. One resource is entitled A Pocket Guide for Tapering Opioids for Chronic Pain. It outlines appropriate times to taper and reduce, or taper and discontinue opioid therapy. The guide also offers information on how to individualize tapering plans to minimize withdrawal symptoms while maximizing pain treatment. In the pain management literature of prescribers, you'll find more useful information such as Weighing the Risks for Opioid Therapy, a publication by the American Academy of Family Physicians, and The Effectiveness and Risks of Long-Term Opioid Therapy for Chronic Pain from the Annals of Internal Medicine. There's also a toolkit of information for prescribers to share with patients. Topics include the risks of opioid therapy, alternative ways to safely manage pain, and safe storage practices for prescription medications. By following the regulations and using best practices, you'll be helping to lead all of Ohio towards safer pain medication use and pain management practices. Thank you for taking the time to learn about Ohio's regulations when prescribing opioids to treat subacute and chronic pain. Once again, details of the rules can be found in Ohio's Administrative Code 4731-11, and resources for prescribers and patients can be found at TakeChargeOhio.org. Together, we can take charge of this epidemic and help create a safer future for Ohio.